My name is Michael Lichtenberg from Arnsberg Vascular Centre in Germany. More and more interventions can nowadays perform via a trans-radial access, meaning we do not need to put the patient in the hospital for a couple of days, meaning we can do an intervention via trans-radial access and analyze the efficacy and safety for and trans-radial access for especially iliac intervention. So we want to learn how we can implement this in our daily routine, and we also wanted to learn how the existing technology, and in this case the Dynetic stent from Biotronic, helps us to do trans-radial interventions of iliac lesions. We aim to include 25 patients with multiple indications for iliac artery intervention, meaning stenosis, occlusions, complex occlusions of both iliac arteries. So multiple indications in patients with Rutherford 3 to 5 having just an iliac artery lesion or occlusion. At the moment, we have already 15 patients included. We just started with this registry, and as an interim analysis after 12 patients, I can say we had very good outcomes in terms of safety issues. No problems occurred, especially with trans-radial access. No bleeding complication or any bailout procedures, which could have been thought of for trans-radial iliac artery intervention, so also very effective. But it's just an interim analysis. We want to include 25 patients and, of course, also evaluate the efficacy in terms of patency rate after 12 months for this Dynetic stent. So it's a monocenter prospective all-comers registry in patients with just iliac artery lesions, so meaning that they shouldn't have any additional FEMPOP lesions, as we are aware that we don't have so many devices on the market in Europe which help us to perform trans-radial interventions also of the FEMPOP area. So we need longer shaft balloons and stents. This is at the moment not available for the SFA popliteal artery. So therefore, we just concentrate on iliac artery lesion treatment. This interim analysis, which we just performed after 12 patients, meaning 50% of the patients included, showed a very good efficacy rate of the stent after 6 months, no restenosis or reocclusions. All patients, all the indications we included in this registry could be treated via trans-radial access. No complications in terms of radial access complication, including occlusion of the radial artery or bleeding complication occurred. We did not have any issues with reaching the iliac artery from the left side. This means, of course, we need to do a very good screening of the patient in terms of underlying subclavian artery access issues or radial access issues. So a good screening is very important for good success. So I think the future of peripheral artery disease treatments will definitely more and more from trans-radial access. It's safe, it's effective. Patients can be sent home very soon after the intervention. So our aim is also perform an economic analysis after the inclusion of these 25 patients. Therefore, I think more and more lesion treatment in patients with peripheral artery disease can be performed in outpatient department, something we already see in the United States in OBLs done. And I think we can definitely copy this and do more and more peripheral artery disease interventions via trans-radial access. So the next step is, of course, to get all the 25 patients into the study. We are close to that. And we'll then perform a 12-month safety and efficacy data analysis, and then, of course, we'll report on that.